Hello, I'm Dr. William Berger, owner and founder of Northeast Medical Practice. We are a concierge-style internal medicine, weight management, and aesthetics practice located in Great Neck, New York on Long Island. And today, another one of our wonderful patients is kind enough to share about his journey in weight loss within our program. So I'll pitch it over to you.
Hi, Sean Murillo, been a patient of Dr. Berger's for a few months now. I came in here, not much expectations, but I had a family member come and give some good feedback, and I noticed his journey and his lifestyle changes and everything. So, figured why not give it a shot. So, I've been taking medication from the doctor, which he prescribed, and along with my daily lifestyle, constant working out, and also I noticed that my appetites have shrunk a lot. I don't eat the normal stuff that I used to eat. Not that I don't want to, it's just I don't feel like eating it anymore. Aside from that, with the with the exercise and everything, I feel much better. I'm down about 40 pounds, something like that, and I feel a lot better. I'm able to do a lot more, and I just feel good.
Good. We're really happy with all of your progress. What kind of dietary changes do you think you made with our guidance, with the use of the medication? How has your diet changed?
Well, for one thing, I don't eat late at night. That was my major thing. I would late night snacking, fast food, burgers, fries, all the good stuff. But
we all love it, of course.
Yeah, but I don't have those cravings anymore. And I don't. I'll have a well-balanced meal after work or something, and then there's no snacking. My sugar intake is reduced tremendously. I guess you would say a pre-diabetic, when I first came in, and that has seemed to subsided for the most part. With the exercise that I've been doing, and just the diet that I'm on now, and it's pretty much a self-induced diet, to be honest. I mean, you gave suggestions, but I took, for the most part what you said, and I just created it, to my own liking, and it seems to have worked.
Great. And you're saying you feel better. I know, you work with the fire department and so forth. How has that affected when you're on the job there?
Well, for one thing, I don't suck down a bottle. We have 45-minute bottles that usually last maybe 20 minutes or so.
So meaning oxygen.
Oxygen, correct. If I was on the job working vigorously, that'd probably last me 10, 15 minutes. Now, I get an extra 4 or 5 minutes, which, could be the difference between life and death.
Sure.
I'm able to, we have a lot of activities, drills where we're on our knees crawling, and that takes, strenuous activity, especially with all the gear on. I'm able to get through it. My stamina's increased. Walking around even, my knees don't hurt as much. My ankles aren't swollen. So things of that nature, I feel a lot better.
Great. Well, again, we're really proud of you. Really glad to see all the progress you're making. Glad that you can continue to do the service that you do for the community.
Appreciate it.
And we're looking forward to seeing even more progress down the road.
Yeah, definitely, for sure.
Okay. Well, thanks for taking a few minutes to speak to our audience about your experience in our practice. So again, we're Northeast Medical Practice in Great Neck, New York. If you'd like to reach out and learn more about our weight management program and the other concierge-style services that we offer, including primary care, you can call the office at 516-604-3418 or find us online at northeastmedicalpractice.com. Of course, all of the information we share in these videos is for educational purposes only. We have not formed a doctor-patient relationship, and if you have concerns or questions, you should not hesitate to reach out to your medical professionals. But in the meantime, thanks again, and be of good health.